This is a small takeaway segment of a piece of your spine of what it looks like on the inside. So you have your nerves that run the entire length of your spine, and they come out in between every two bones like this. The main function of these nerves is to carry life-sustaining messages from your brain out to every muscle, organ, gland, tissue, and cell in your body. This is what makes up your central nervous system. So what a subluxation is and what can happen is when one or more of these bones get shifted out of their normal alignment, and it can look something like this. That subluxation or that bone puts pressure on the nerve and blocks the communication from your brain from reaching whatever body part is on the end of that nerve. If your organ is on the end of that nerve isn't getting the messages correctly from your brain, then it's not going to be able to function correctly, and that will affect your overall health. For example, if you're subluxated in the upper regions of the neck, those nerves affect a lot of the brain, eye, and ear function, as well as the arm, hand, and finger function. As you go farther down in your spine and you enter into the mid-back, then it can affect your heart and lungs, as well as your digestive system. And as you go into the low back, the legs and feet become affected. So with subluxations, there is a serious secondary complicating condition called degenerative disc disease or degenerative joint disease. When your bones and discs are subluxated or out of alignment, your body can put up to 200 times the normal pressure that's meant to be placed on there. Unfortunately, our body isn't designed to hold that amount of pressure when it's out of alignment, so the bones and discs will start to decay or degenerate. So we like to compare it to when your car is out of its alignment and it's putting extra pressure on your shocks, your brakes, and your tires, then those will tend to wear down, as will your bones and joints. If your subluxations are caught early on and they're treated and corrected, then you can avoid the degenerative change from happening. If they're not treated or corrected, then they're only going to progressively continue to get worse. So you have your textbook normal with a very healthy disc, a very healthy bone, and very good nerve space. As you enter into degenerative change due to the subluxation and the extra pressure, then you start to get a little bit of a loss of height and width in your bones and your discs. As you move farther into degenerative change, your body will start to develop something called bone spurs, and the instability caused by the subluxation and degenerative change can cause disc herniations or disc bulges. As you go farther down into the degenerative change, you'll reach a later phase where there's no longer any disc left to cushion between the bones, so it's bone grinding on bone. What can also happen is something called spinal stenosis or narrowing of the canal, where there's no longer any room for your nerve to run.